covered by insurance for people. They're FDA approved medicines, and they are recommended over Coumadin in the most recent guidelines. So again, the one I like is called Eliquis, Liquis. So in the studies, after somebody had a stroke, they waited 2 weeks to put people on this kind of medication. Until then, we used aspirin or low dose Lovenox, which is a shot you had in your belly once a day. Another doctor stopped that today, and we'll talk about why that is just a second. As far as things go, most of the tests and stuff are done. Now you're kind of in the recuperative phase. We just want you to work on getting better with the therapist. So you did well with your speech therapy swallowing test. Physical therapists, occupational therapists are going to work with you. Right now you're tending to not really pay a whole bunch of attention to the left side of your body. And that's probably going to get better after a week or 10 days or 2 weeks from now. You know how you're kind of looking to the right all the time and you're not looking at me right now? Yeah, so that's probably going to get some better. So the brain scan that you had today, that I guess I can pull the thing in here and show it to you. Didn't think about that. Pull the card in here. Take me a minute to load this up, so you might want to push pause. It takes a lot of data to pull this up. So the scan is going to show the extent and size of the stroke. Just a second here. Doctoring anymore is a whole bunch of computer programs and waiting for them to load. All right.
Look at that.
Yep. Yeah. All right. So, first I'm going to show you the stroke.
Can you see it, baby?
Can you see the scans here? Can you see my hand?
Yeah.
Yeah, follow my hand here.
I see hand.
See my hand?
Mm-hmm.
All right. Do you see my hand now?
Uh-huh.
All right.
Yeah.
Yeah, I don't think you're looking over in this direction.
That's,
Well,
Look at the computer he's got,
I
Mom.
know it, hon. I was looking at you. But
Yeah, look at
I
him.
won't look at you.
Watch your computer, baby.
He's going to show you your brain,
see,
Mama.
follow my finger here. Well,
Yeah.
this is the stroke, this white area. That shows us the area that didn't get blood for enough time for this part to die. And it's an imaging technique called diffusion imaging. It tells us where these pumps in our cells don't work. The other thing I want to show you is this. This is a different kind of imaging technique. It's called gradient echo MRI. And this black spots here is a little bit of what we call petechial hemorrhaging, but little dots of blood that have weeped out of blood vessels. So it's not a brain hemorrhage per se, but a fair number of people with strokes will have this, but this increases the risk of this turning into a big bunch of blood. And so the other doctor started you on a blood thinner medicine called Lovenox shots to reduce the risk of clots in the leg, and also a little bit to help stroke risk. And he stopped that today appropriately because of this finding on the scan that you had on the 20th. So we still have you on aspirin, and we're going to continue that. It's a toss-up between risks and benefits. If we don't have you on anything, there's more risk of another clot forming in your heart.
That container on the low dose aspirin.
Yep.
She's been taking that a long time. I've been taking it for years.
Yep. And aspirin does reduce the risk of stroke in people with this funny heart rhythm, about 15%. But the medicines I'm talking about reduce the risk about 75% or 5 times more. So that's why we're going to convert to that in a couple weeks if her scan is fine in a couple weeks. So this part of the brain here, when people have strokes here,
She'll have to come back up here and y'all do the scan up here.
that's correct, unless I can't say, she might still be here doing rehabilitation at that point. It's frequently the case that they just, if you're in rehabilitation, if you go somewhere else, you could get the scan somewhere else if there's another place closer. I don't know where.
Starkville, that's where we live in Starkville.
Yeah, so that could be done in Starkville, that test. That's not a big deal. It only takes 5 or 10 minutes.
And they got a rehabilitation place in Starkville too, at the hospital.
Yeah, so if you'd rather go back to there to do that,
Yeah, we live there.
that's fine with us. And they can follow our directions and get that test and start the medicine. Good. All right. Any questions for me?
Oh.